Thank you very much, Lynn and San YuMay, for preparing this next intervention.
Thank you. So I wanted to talk about two things in respect to the challenge for Europe that we're coming up with about preparing medical professionals on environmental health and climate change. Two things to consider. What is there going on so far, wherever it's going on, and what opportunities do we have that we can support and join with? And I'd like you to bear that in mind as I go through my talk. So I'm YuMay Tun, and I am a medical doctor by background. I was a GP for a long time, and then I went into medical education. I'm a PFHEA, so a Principal Fellow of the Higher Education Academy of the 4 levels of recognition for university educators. That's the highest level. And I also have a postgraduate degree in environmental science and policy. So I'm quite transdisciplinary in that sense. So something that we worked on for a long time and the GMC eventually provided was a sustainability duty in good medical practice. So this is a mandatory thing from our medical regulator. And it's got 2 parts, and this came into effect in January of 2024. You must, which is a mandatory thing, bear in mind your responsibilities to the wider population. This is groundbreaking, and also you should choose sustainable solutions when you can to reduce the environmental impact of healthcare. And I think that we've touched on this a lot today. And because medical professionals don't really know what sustainable healthcare is, they provided a definition. What is sustainable healthcare? And that definition is something that has been adopted by AMI, the International Association for Health Professions Education. It's been adopted by the Medical Schools Council, the umbrella body of all of the UK's medical schools, and of course now by the GMC, our regulator. And this definition was derived from my research, which was published in Medical Teacher in 2019. It talks about improvement of health, better delivery of healthcare, which results in benefits to patients and to the ecosystems on which health relies in order to provide high quality healthcare now and for the future. And I've adopted the principles of sustainable healthcare from the Centre for Sustainable Healthcare, and I have prioritised them, and it was originally prioritised in the first paper, prevention, and then patient agency and self-care, lean care systems, and when you have done all of those in that order, then low carbon alternatives or decarbonisation, which is a very hot topic right now. And I would say that planetary health feeds into the prevention side, because when we have a healthy planet, then we can have human health. Planetary health has other definitions, but this is the definition from the Planetary Health Alliance. So planetary health is a solutions-orientated transdisciplinary field. It addresses the impacts of human disruptions to Earth's natural systems on human health and all of life on Earth. And the Planetary Health Alliance has done a huge amount of work over several years on action, because it is a social movement, it considers itself a social movement. So action, it talks about integrated solutions, it talks about coordinated actions, it talks about what relevant work is already underway. And then here you can see some examples of planetary health education. It's listed in another document over several pages, but there you can see this document, Education for Sustainable Healthcare, a curriculum for the UK. I led the national working group that developed this document. It's innovative in as much as it doesn't give you the verbs, it just gives you a list of topics. It's therefore adaptable to different contexts. It was fully endorsed and published by the Medical Schools Council, and the GMC put it on its list of documents informing its required outcomes for graduates to qualify as a doctor in the UK. So it's freely available, it's been downloaded, but we don't know who's downloaded it and who's using it. But I recently spoke to somebody who was a consultant surgeon in Ottawa, and he said that it's being applied across the courses there. So it would be nice to know, where it's being used, but we actually don't know. The Medical Schools Council also allowed us to establish the MSc ESHA, so Medical Schools Council Education for Sustainable Healthcare Alliance. And that is important because it's alongside only 3 other alliances, so for assessment, for selection, and for EDI. And I did research, this is in the paper Fulfilling a New Obligation. I did do research some time back about how to get sustainability, action on climate change into the medical education curriculum, and published this paper. In its time, it was one of the most widely read and cited articles in Medical Teacher. And you can see that it's actually not an easy process. It involves a lot of things, and particularly faculty development. And I've been doing a lot of faculty development across medical schools across the UK and also a little bit internationally. Amy, we worked on a consensus statement. This took over a year to develop this paper with 33 authors across all 5 continents, and educators from deans of institutions all the way down to students in several health professions. And in the consensus statement, we established planetary health as part of or encompassing education for sustainable healthcare. So ESH, or Education for Sustainable Healthcare, has become part of the vocabulary of AMI, the International Association for Health Professions Education. And in Switzerland in August last year, I was able to put on a symposium from international collaborators who are doing their own teaching, either from the curriculum document or parallel documents that they themselves are developing. So the GMC itself has been persuaded to look into education for sustainable healthcare, and this is the chair of the GMC, who was speaking at the NHS Highlands Medical Education Conference last year. And this is when I took a screenshot of her building up her slides. So these are the bullet points as she built them. I just took a shot at this point. She's talking about engaging with stakeholders to identify opportunities to include sustainable healthcare. She said at that point, which was May of 2024, it was unclear the level of impact of ESH, of the curriculum document, and I would say that 18 months on, the impact has grown because we have established the Medical Schools Council's ESH Alliance, and every single UK medical school has nominated representatives to the Alliance, and therefore we have reach across all of that. But I think we can discuss later, how that will progress with, to wider impact within the medical schools. And then she talks about the ongoing project with the Planetary Health Report Card. So the Planetary Health Report Card is a student initiative that started with a handful of medical schools in North America. It spread to the UK, where I helped to make it more international. It's now spread to, I think, 10 health professions now, so not just medicine, but nursing, pharmacy, physiotherapy, occupational therapy, vet medicine, etc. And as you can see here, it is in 21 countries now, in 188 health professional schools. And sorry about the corruption of the title at the top. This particular chart on the right is just for medicine and just for the UK, but you can get similar ones for other health professions and for other countries. The GMC was prevailed upon to develop and publish a position statement, planetary health and sustainable healthcare in medical education standards and outcomes. So it talks about its own ambition and what it wants to do. So to incorporate planetary health into clinical decision making. It talks about the ESH curriculum, which provides important definitions. It talks about disease prevention, healthcare provision, and talking about ESH throughout the entire patient pathway. Talks about the sustainability duty that it had put out, and it says it is imperative that medical students receive education in ESH and planetary health, enhanced recognition of planetary health and ESH. They want to put it into all their outcomes and standards. So that is nice to have as a position statement. When I'm teaching students, some of the very keen students are exceptionally keen. They put a lot of heart and soul into this. So a student has done a student's guide to the planetary health diet. So a recipe book, beautifully produced, and she had tried out all the recipes on her peers and worked up the recipes, photographed them, costed them, and done peer-reviewed evidence on how it's good for planetary health. Another student, came to me when she realised that the clinical skills laboratory, where she was learning to do the clinical skills, was being very wasteful of resources, pouring co-moxiclav down the sink after they had learnt how to use it, etc. And so we changed all that, and we reused equipment. We didn't have to have sterile disposables because you don't need sterile equipment for a mannequin's arm. And we published a paper with standard operating procedures where other universities, medical schools are also adopting some of these policies. And also patients who are on their clinical placements, think about deprescribing. So polypharmacy and overprescribing, and how deprescribing can help both the patient and the planet. So this is undergraduate medical education that I've been talking about so far, but all of the UK Royal Colleges, I think, are thinking about sustainability in their own fields. This is general practice because obviously I'm a general practitioner by background and registered with the GMC. Greener practice is now well established as the primary care sustainability network in the UK. They're doing a lot of work on education as well, and I co-lead the education side of that. So, these are opportunities for collaboration, and there are also resources that are already available, even here at UCL, for example, the MOOC, the massive open online course, which is it was freely available online. I don't know what FutureLearn has done about that lately. I haven't had a chance to check, but it was free at the time. Lots of expert contributors. So these are all projects that I have been involved in. There are many, many more that I could talk to you about where I haven't had such a deep involvement, but there is a lot of stuff. So the take-home messages, I would say, are consider what is already underway, and think about the opportunities to join, support, or collaborate with existing initiatives. I think that environmental health and planetary health are very well aligned. And the idea is to reduce the need for healthcare. And happy to take questions, but I think that talking about reducing the need for healthcare would lead in very well to my colleague, Professor Gabriella De Luca.
Thank you very much.